Hi everyone, my name is Szymon Piątkowski and I'm the founder and CEO of Saventic Health. We create AI-driven algorithms to diagnose rare diseases. The current approach to rare diseases is not efficient. We identified quite a few problems. Lack of medical specialists, limited know-how in rare diseases, lack of holistic approach, and growing number of medical records that doctors cannot analyze. This is why the diagnostic journey can be long, frustrating, or even fatal. It can lead to the correct diagnosis, incorrect diagnosis, or too late diagnosis. Our technology supports patient pathways, and we can diagnose the diseases at early stage. Few words how we do it. So first of all, we obtain large amount of medical data from hospitals. Secondly, we test different type of data science techniques, artificial intelligence, algorithms, or machine learning solutions. And finally, we do tests, both retrospective and prospective tests. Since then, algorithms are ready for implementation. At this stage, we focus on 8 segments of algorithms, of rare diseases algorithms. We are most advanced with blood and bone marrow diseases, metabolic diseases, as well as immune disorders. We don't create any new software. Our algorithms are implemented locally or via API with existing software systems in hospitals or medical clinics. And this is a good example. On the left, you can see the input data, so laboratory test results and descriptive medical information. And the algorithm provides feedback. In this case, myeloma has been identified. And we also provide reasoning for doctors, so identified symptoms and anomalies. Market is very sizable and fast growing. It's expected to grow by 10% in the following years. Surprisingly, 6 to 8% of population suffer from rare diseases, and only 1 out of 8 patients is diagnosed on time and duly treated. Our business model is based on subscription model. We have 2 types of clients. One, pharmaceutical sector, when we provide support mainly for ultra-rare diseases in order to diagnose patients for treatment or for clinical trials. And second, healthcare providers, where we focus more on packages of rare diseases and we provide cost savings, also improving the quality of care, limiting number of potential errors. We already generate revenue and we've already signed for 250,000 euros for the following year. This is our team, a strong mix of technology, healthcare, and business experience. We are looking for partners to test and implement our algorithms, our solutions, as well as potential investors that would support us in international expansion. Thank you very much, and I'm happy to answer your questions.
Wonderful. Do we have you on the line?
Yes, sure. Good morning, everyone. It's Szymon Piątkowski here.
Hi, good morning. Again, for anyone in the audience that would like an intro to Saventic Health, feel free to fill out the poll that just launched below. So 2 questions for you. First one is, what are your competitive advantages?
Well, we see 3 main competitive advantages in our business. First of all is the medical database. So we obtain a lot of medical data, full data, from different hospitals, mainly university hospitals. We have almost 1 million patients with full data already, and we're signing new agreements. So we expect to have, by the end of next year, 2.5 to 3 million patients in our database. So this is one. Second thing is our techniques. So we create AI algorithms based on existing libraries in Python or different type of solutions, but we also started implementing and creating our own algorithms based on Bayesian networks. And third, I would say our team, our fantastic team. So the great mix of people that I presented, I think it's one of our core assets. So I would say the 3.
Great. And it looks like there's a question that just popped up. Are you open to rare disease not on the list you showed?
Sorry?
Are you open to rare disease not on the list you showed?
Yeah, sure. We are open to different type of diseases. In the presentation, we presented just few of them, but it's not that we focus just on the presented rare diseases, because we're developing in the same time new diseases. It depends on the market needs. It depends on our discussion with clients. So obviously, yes, we have some more in the pipeline, and we're happy to cooperate in terms of creating new algorithms for new rare diseases.
Great. And one last question. How much data do you have in your medical database? Or for example, how many unique patients with full EHR?
Sure. So for now, we have approximately 1 million unique patients with full data, like laboratory test results, imaging diagnostics results, all the descriptive medical information, drugs prescribed, as well as diseases. But as I mentioned, every month we sign new agreements. So this database is growing and growing.
Wonderful. Well, thank you so much for joining us. I think that's all the questions we have for you today.
Thank you very much.
Thank you.